Great, that's very helpful. And so we're very lucky on this panel. We have yet another innovative financing facility represented, or at least a related one, the Global Fund. And Adam, not only being the innovation health financing specialist there, but also coming with a background in financial markets and private equity in particular, I think is, again, very well positioned to speak to us. So, Adam, the Global Fund has pioneered novel ways to raise and spend monies for global health. So in your organization's model, countries draw down against promissory notes. Is there a way to repurpose funds that are never drawn down? And would investments in health systems or pandemic preparedness be seen as an appropriate repurposing of funds?
All right. Well, thanks for the question, and good afternoon to everybody. When I hear the word, I guess, repurpose funds, which is a couple words, it's kind of uncomfortable. It reminds me of buying some really tight pants that just didn't fit right. And because in the world of development and donors, you don't want to hear the word repurpose because that means you did something wrong or you have too much money. And so I think in that context, when we sort of look at how the Global Fund raises capital and how we deploy capital, there's a couple different pockets. And one would be from donor governments, which actually provide the capital, and they can provide that actually through either direct donation over 3 years, or it could be through a promissory note. And a few months back, or maybe 6 months ago, we had a donor come to us and say, we're looking in the future and we're not going to be able to give you as much money as we used to be able to. Can you come up with a way for us to get it in the budget, say this is how much money we're going to give you, but maybe you don't draw it all down at once, and maybe you do it over a period of 5 or 6 years. And so we looked at what the World Bank does when they actually pull in capital. And so there's a lump sum fee or a lump sum commitment from a country, and then there's a promissory note, more or less, where they said over the period of the next number of years, your country will give us money on a revolving basis so we can pull it down. We're like, wow, that's a pretty good idea. So how can we actually apply this to some of the grants and some of the funding that we use? Well, we get maybe $500 million from country A, and at the same time, say, put another $500 million in a revolving fund. And the revolving fund would last 5 years. And every year, you split that $500 million over $100. So 100, 100, 100. And if that money is drawn down over certain conditions, great, we use it. If it's not drawn down, then it goes back into the pot for the country. So in that regard, it's kind of interesting because then there's not that sort of repurpose of funds. You're using it on a needs basis, and I think that's really efficient. But how this can also work for say, pandemic, and why I think it's an interesting question, is because you could do something very similar, where it's sort of a revolving fund, and we've talked about this today, but the problem with actually having a permanent fund is it comes with some expenses, and then donors might get a little annoyed if they keep putting money into it and it doesn't get used. So this is more of like a pay-for-performance type structure. So in this case, where I think there could be some use for this sort of repurposing and how kind of promissory notes may play into it, is more within our, we have a new fund, which we just passed with the board's approval, which is an emergency fund. And we put $30 million into this bucket, and this was actually a response to the Ebola crisis. And essentially, we've put $11 million in the market with 5 countries. But it's not just for health, but it's also for other crises like in Syria and in countries in that region. And there's some eligibility criteria. But I guess the issue that we run into is that we're very stringent in terms of how this money can be used. It's basically used for HIV, TB, and malaria. And it can actually be used for health system strengthening. And that's where we sort of are a little bit envious of Gavi. And maybe no one from the Global Fund would ever say that, but I'm comfortable with that. In the fact that they can actually leverage their balance sheet in a way that we can't. And this is sort of the point that I was talking about before, is that if there's actually some kind of blanket mandate where funds like the Global Fund can actually use their money in crises like pandemics for specific reasons, that would actually go a long way. But until that happens, we're very much stuck in the diseases that we focus on. And any innovation that goes along that path is going to have to sort of be dictated by that. With that said, there is a movement into doing more health system strengthening, and in that regard, there's a lot of overlap between some of the diseases that we cover and others that we classify as pandemics. So there's movement, but it's slightly limited in that regard.
Okay, thanks very much. Now, Adam, as I mentioned before, and you're working at the moment essentially with public sector finance, but your background in the past is you've been working in the private sector, and so it would be interesting to hear a little bit, drawing from your experience about how the public sector and the private sector, if they're engaged in pandemic finance, how would this work in terms of their very different tolerance for risk, their willingness to disperse funds, the incentive structures they face to disperse funds, the accountability and fiduciary standards that they face, the risk of shareholder suits and so forth on the private sector side. Could you comment about how to accommodate these differences within an innovative financing instrument?
Sure. So when I think of private sector investing, the first thing I think about is risk-adjusted return. And if you're going to a private investor and you ask them for some capital for a risk that is today, then essentially there is no risk-related return because you know where the risk is. It's 100%. And so you're going to have to adjust your return for that. So there's a class of investor that might be interested in that. But if you're talking about kind of the typical sort of social impact investor, the return for that would have to be pretty substantial because the risk is identified. So essentially, I think that's the logic that you start with when you're dealing with the pandemics, is that the risk is there. And so what you need to do is then structure something that allows money to flow in ahead of time on a somewhat kind of commercial basis that then could be complemented by governments. And so if we use Aaron's data point earlier, which is 28 cents on the dollar is wasted, and you use that working backwards as some kind of like return on capital, then you have some room to work with. And so with that regard, you might look at a social impact bond. Did I say that? Yes, I did. And why do I say that? Well, let me backstep a little bit. When I look at the Global Fund, I think that's actually one of the most original and interesting pandemic funds because it has a couple different sort of avenues to it. I think of it as the FBI, the SWAT team, a revolving credit, an ATM, and a temp agency. And why do I say that? Because the FBI is the local resources on the ground, and that's the surveillance that we talk about. The SWAT team are the rapid response, which is necessary to deal with these issues. You have the revolver, which is a credit line, which is basically the pocketbook, and then the ATM machine, which is sort of on the ground, being able to distribute cash quickly. And then you have the temp agencies, which is basically the capacity building, and that's actually the team on the ground. So if you put all these pieces together, you actually have a pretty interesting structure. And so if you can actually go ahead and put this in sort of a parallel light to what a social impact bond is, which is essentially taking investors' money up front, putting it into an intervention, on top of that having a learning mechanism which can actually course correct quickly, and then having the government repay back the investors upon success. I think that would be a very interesting pandemic structure, and that could be done on a regional basis. And the returns for that would have to be 3, 5, 10%. I don't know. But I think that's something that hasn't been talked about yet, and it might be very interesting. So, and so then to kind of like go back in terms of what the sort of the accountability and the fiduciary standards are, I think that all gets bundled into there. And that's more of a kind of a detailed conversation because I don't think it's one answer for every, one answer encompasses all products. So yeah.
But if I could maybe draw you out a little bit more on this, we had the discussion about insurance this morning. You've talked about social impact bonds now. So when we're talking about private sector capital, and if there's an event, a drawdown, that's going to represent a loss for investors. Whereas on the public sector side, particularly on the development side, we exist to help. And so for us, making a response, that's why we're there. So I wouldn't say that necessarily we like to spend money, but the incentive structure is much more oriented towards making a disbursement. On the private sector, it represents a loss. How can you see those two things being squared out? Are they contradictory?
Yeah, no, absolutely not contradictory. maybe that's contradictory. But the point being is that investors are actually happy when money goes out because that means your money is being put to work. And as long as there's somehow a mechanism to compensate the investors back for that, they don't necessarily need to have a high return. So, for example, in South Africa, we're working on a sex workers social impact bond. The investors may look to be philanthropic investors that just want their capital recycled, which is actually a big theme these days. Even donor governments want their money recycled. They don't necessarily care about the massive return, i.e. DFID and other groups. So if you actually put a private investor and you sort of go ahead and say maybe a government's an actual private investor these days because they're looking to recycle their capital, then the equation looks very interesting because you're having public investors who are actually acting as private investors, if that's not too confusing. And to your point, as soon as the money flows out, as long as there's a mechanism for them to recoup that capital, then I think, and as long as you're aligned with the interests and you have well-defined outcomes, then I don't think there would be a conflict. But the important piece here is that you have to have a learning mechanism, a course-changing mechanism on top to actually go ahead and make sure that you're guiding it properly and efficiently. And in these situations where you have pandemics and it's about getting the money quick on the ground and putting the resource to work, I think the fact that a social impact bond has that learning mechanism, and if you sort of add to that one other component, which you have pre-qualified partners there, then actually it could be a pretty interesting concept.